Hello everyone, so I just finished my anesthesiology rotation and I thought I would make this video in hopes that it would be helpful to some of you guys. Especially if you've never done anesthesiology before and you have no idea what you'll be doing or what it will be like. So I'm gonna break this video down into, let's see, 1, 2, 3, 4 parts. First one being what to do in the pre-op holding area. 2, what to do in the OR. 3, in the recovery room. And then 4, just resources and some tidbits that I hope you guys find helpful. Okay, so first, in the pre-op holding area, that's where you'll be meeting your patient. There you'll be talking to the patient to gather history and also do a physical exam. So when you gather your history, get their name, age, the procedure they're having, and also get any past medical history and surgical history as well. And regarding their past surgical history, you want to find out what kind of anesthetic if they had it before. And of course, any allergic reactions or adverse reactions they had. And also get their family history just in case there's a risk of malignant hyperthermia. Then you also want to do a review of systems. So for cardiovascular history, obviously get their, if they had a heart attack before, if there any coronary artery disease, but don't forget to ask for their functional status. So by that, you want to ask, can you go for a walk for more than 2 blocks without getting short of breath? Or can you climb up 2 sets of stairs without getting short of breath? For respiratory status, you want to get if they have any asthma and COPD. And regarding that point, you want to ask if they had any recent exacerbations. So getting if they use their inhalers and how frequently they use it, any steroid use recently or long term, and any recent hospitalizations or admissions for exacerbations. Oh, and don't forget to ask if they're a smoker as well. And for GI, what's important here for anesthesia is GERD. So ask if they have any acid reflux. And for endocrine system, diabetes, and also their BMI. So I got into the habit of asking their weight and height and actually calculating the BMI as well, and then including that in my presentation when I would talk to my preceptor afterwards. And of course, get any previous history of strokes and neurologic deficits. That's important. And any general or urinary system diseases they might have. Also, make sure to get their NPO status. So for us here, it's no clear fluids for 2 hours before the surgery date. And then of course, no eating solids for about 8 hours. So for the physical exam, you are basically doing an airway assessment. You want to look for mouth opening, theromental distance, any neck mobility issues, and of course their Mallampati score. And also ask if they have any fake teeth, especially these days, veneers are very common. So those are very expensive, so you want to try your best not to chip that veneer. In addition, just look for things like overbite or underbite as well. So those are also important to include when you're presenting the patient to the preceptor. So for part 2, you're now in the OR. You have talked to your patient, did your area assessment, and already talked to your preceptor about what the plan is going to be for their anesthesia. So in the OR, you are going to be helping up attaching monitors like blood pressure cuffs, ECGs, and then getting ready to bag mask them. And if they haven't had an IV already, you're gonna be starting an IV. So for my tip for starting IVs, it's actually harder than you think it is. Nurses just do it really well. But my tidbit is do not go at a 45-degree angle when you're inserting your IV. You want to go at a lower angle that you might think you will be needing to. And another tip is, don't try if you don't think you're gonna get it. You have to be almost 100% sure and have confidence that you will get that IV. And so you want to set yourself up for success. Otherwise, just don't try until you have everything perfect. Okay, now the patient is ready to be intubated in the OR. So you're gonna be intubating, and afterwards, the surgery will start. And now it is prime time for pimping. So you do get as much pimping as you do in surgery. So get ready to be asked a lot of questions about drugs. So I got asked a lot of questions about locals, pressors, sucks, and other muscle relaxants as well. So make sure you know the doses, how they work, any contraindications those drugs might have. And also they asked about half-life and onset time as well. So those things are actually important, so make sure you know them before you go into your rotation. So part 3 is now in the recovery room. So you extubated the patient, you will now be wheeling your patient to the recovery room, and that's where you will hand over the patient to the recovery room nurses. So briefly, you're gonna tell them the patient's name, age, procedure, any allergies, and any past medical history that's significant. And also you wanna tell them about the anesthesia, so what kind of anesthetics they had, and also the doses of the drugs that were given to the patient. So part 4 is resources and tips. So for resources, I read Clinical Anesthesiology. This was a recommended book by a senior anesthesiology resident. So from what I've heard, it's a pretty junior level textbook, which was actually perfect for me, having never done anesthesiology before. So I thought it was really helpful. And I also used Up to Date as well, just to quickly look up things as I needed to. And for tips wise, so you want to be helpful in the OR. So that includes obviously helping transfer the patient, getting the patient to the OR. Also, you want to help tie the scrubs of the surgeons if there's no one around or the nurses are busy. In addition, you want to get things ready before you actually start the cases. So it might be helpful drawing up some drugs, getting any tubes or LMAs that's not in the room. In addition, get any saline bags like ringers if you think you're gonna need another bag for the case. So lastly, if you're really keen about anesthesiology, you can look up the patients before, see the procedures they're having, and check their past medical history so that you know them a little bit more. So that's it for me here. So have fun, learn lots, and enjoy your journey to becoming a doctor or enjoy your residency. Bye.